Welcome back, everybody, and thank you for coming this afternoon. Richard Sloggett is going to be our next speaker. Richard is here. He's the founder and project director of Future Health. He's also been named by the Health Service Journal as one of the top 100 people in healthcare and is a regular commentator in the national media. And he's been doing this piece of work, which I think is really interesting, and hiding in plain sight, tackling malnutrition as part of the prevention agenda. I think you're going to find this is a really interesting talk about what's been found in his research. So over to you, Richard. Thank you very much.
Leslie, thanks so much. And it's great to be here today to talk through, as you said, our research paper, which we published last week in the run-up to Malnutrition Awareness Week. I'm going to share my screen. I've got a few slides that I will talk through over the next 15 or 20 minutes. I'll just make those full screen if I can. There we go. So yeah, I'm Richard Sloggett, as Leslie kindly said. I'm the Programme Director here at the Future Health Research Centre. We're a public policy centre focused on preventative healthcare, the use of new technology in health, and the relationship between health and the economy. And we were commissioned by Danone to publish a piece of research on the impact of malnutrition as part of the prevention agenda. So the report was published on the 30th of October, and it sought to provide updated estimates of the impacts of malnutrition on health and social care services. Lots of excellent work has been done on this in the recent past, particularly the work by Beepen, particularly thinking about the 2015 study and the economic study. What we sought to do was to take those existing studies and methods and apply them to the latest healthcare activity and population data in England to try and develop new national and regional and health system estimates of the impacts of malnutrition. All findings in the report are estimates as a result, and we've labelled them as such, and there's a sort of methodology included within the final research paper. I was delighted to say that the report was covered by the national media, so it was picked up by the Daily Mail and the Daily Mirror last week. And the report makes a series of recommendations for how government and the health system should take new efforts to tackle disease-related malnutrition. And I'll come on to some of those a little bit later in the presentation. I think the first thing that I wanted to sort of pick up on, though, was obviously a lot of work has been done on disease-related malnutrition and its impacts across the UK and health and social care services. These were some of the findings that sort of underpinned our analysis and the research that we undertook. So we know that 5% of the adult population in the UK has disease-related malnutrition. The health and social care costs for a person who's malnourished are 3 times those of a non-malnourished person. Currently, demographic change and the ageing society means that the impact of malnutrition is set to increase. We know that those over 65, and particularly those over 85, are going to increase substantially over the next 10 to 15 years. And in the research, we set out some of the impacts of that and looked to 2035 as a year and sort of looked forward as to how the impact of disease-related malnutrition will increase over time. We also know that deprivation is a driver of increased disease and disease-related malnutrition as a result. And then on healthcare usage, there are studies that show that people with malnutrition are twice as likely to visit a GP. And we know that people with malnutrition are also far more likely to go into hospital and stay longer as a result of having malnutrition. We also know that malnutrition increases with age, and that an estimated 35% of care home admissions are related to malnutrition. 1 in 6 carers is looking after someone at real risk of malnutrition, but does not have any nutritional support of any kind. That's work that's been done by Carers UK on the specific topic. So when we sort of did our literature search and literature review starting out on the project, these were some of the things that were very much front of mind as we started to look at projections for today and in the future. So what did we find? Well, we looked at England only. That's the first thing I should say. So we only focused on England, and we found that there are we estimate there are 2.9 million people in England with disease-related malnutrition, and that cost to the healthcare system is £22.6 billion a year, so slightly higher than the previous Beepen projection back in 2015, which had it at between 19 and 20 billion, so the costs have gone up. The majority of the costs are in secondary care, so mostly within hospitals. And if we think about how much under pressure the health system currently is, and particularly the hospital system, efforts to tackle malnutrition could have a real benefit in terms of supporting the sustainability of our healthcare system. Other costs that we estimated were in social care, obviously with that mostly, although not always predominantly older population, of 5 billion. And then there's also costs around GP appointments and activity in primary care of nearly 2 billion. So our updated estimate lands the figure at 22.6 billion pounds a year is the cost of disease-related malnutrition to healthcare services. And then one of the sort of, I think, most important things that we then tried to do is, and this was where I think the analysis went a bit further maybe than has been done previously, is to try and estimate what the impacts are on a regional level. So as I said earlier, deprivation and aging were two sort of driving factors for higher rates. So what we then did was we looked at the population profiles from a deprivation and age perspective of different integrated care boards across England. These are the 42 systems that make up the current healthcare structures, and sought to project that national figure of 2.9 million across the 42 systems to see how it would play out and which areas of the country would have higher rates. And what we found was that northern parts of the country and coastal areas such as Kent, Norfolk and Cornwall all had higher rates of malnutrition than places in the sort of south and sort of southeast parts of the country, and London as well. So we found that there was that sort of distribution of malnutrition across the country from rates from about sort of 3% in sort of places like southwest London up towards 7% of the population if you went to places like Cornwall or Norfolk and Waveney, where populations are older and there is higher levels of deprivation. So that the report sets out some of the data and regional variations, all estimates across England. Then we sought to provide updated calculations of what the costs would be for each of those healthcare systems and what the proportion of their cost is being spent on malnutrition. The first thing we found was we updated the difference in cost between a malnourished person and a non-malnourished person. We found that difference in cost in light of inflation and changes to prices is now £7,775. That built off the work that was done previously by Bapen, and we found that 9 integrated care boards are spending over 20% of their overall budget on treating and managing people with malnutrition. The area with the highest proportion of the budget is in the Midlands, was the Black Country ICB. There are some systems that are spending a lot less. They're spending less than 15% of their budget, often to do with the fact that their populations are younger and have lower rates of malnutrition. The lowest there is South West London ICB, which has a 12.7% rate. So distribution by numbers of people and the distribution of costs and what that looks like as an overall proportion of costs was something that we wanted to explore in the work and update the previous analyses that have been undertaken. But again, quite a widespread of cost impacts on health services that we've estimated there at an integrated care board level. And as I said, within hospitals and secondary care, there are the largest costs recorded for disease-related malnutrition. So, and the NHS data supports the fact that the numbers of people being affected is increasing quite rapidly. So if you go back to 2009-10, there was something like 3,500 people who were recorded as having a primary secondary diagnosis of malnutrition. That number is now up towards 10,000 in 2020, 2021. Obviously, quite a lot has happened since 2020, 2021, but at the same time, that's a sort of 2.5, threefold difference from where we were 10 years ago. Now, the main thing here, of course, is that there's a very much a view that this is a significant underreporting of the scale of the problem. If 2.9 million people in England are estimated to have disease-related malnutrition, only 10,000 recorded diagnoses is a very, very small percentage of that overall number. And what we picked up through a set of expert interviews that we did, and from looking at the wider NHS trust data, which is set out on this slide, is that most trusts are recording lower than 200 cases of disease-related malnutrition a year, which, given some of the previous data analysis that I've set out on the percentage and proportions and the overall costs, feels very, very low, and feels like lots of people with disease-related malnutrition in hospital are not necessarily getting a diagnosis that they need. Interestingly, there is one major outlier here, which you can see on the left-hand side of the x-axis. That's Wirral University Teaching Hospital. And when we did a bit of research into what they were doing, they had prioritised the recording and screening of patients coming into hospital. That was included within their sort of key frameworks that they use on an admitted basis for patients. and also within some of their quality controls. So they've recorded 1,200 patients themselves. That's over 10% of that overall 10,000 figure just in the Wirral, and it's 6 times higher than the nearest related trust. That's quite a big discrepancy, and shows, I think, there's a lot of underreporting of the scale of the challenge here within the hospital system. What we then sought to do was to sort of work out what that level of underreporting might be. And what we did was we sought to calculate how many extra hospital admissions a year there are due to someone having disease-related malnutrition, and how that compares to the overall number of admissions seen within healthcare systems. And what we found was that there were nearly 500,000 people admitted to hospital a year due to malnutrition. So the 10,000 that the system collects is about 2% of the overall numbers of people who could be recorded as having a primary or secondary diagnosis of malnutrition. So that's an estimate based on past studies of the rates of admission for a person of malnutrition, and we then use that estimate and the numbers of people affected to come up with that 464,000 figure. And again, if you look at the distribution of where those admissions are and how they relate to their overall proportions, there's some quite stark sort of regional variations. Some of it aligns with what we've seen previously. So again, some of those coastal systems on the map, so Cornwall, Kent, Norfolk, for example, recording quite high rates of their overall admissions as a result of malnutrition. And other systems, particularly looking at somewhere where I am in Hertfordshire, recording much lower rates, down at sort of 2% of their overall admissions. But I think one of the things that we wanted to stress with the report is that these are estimates, but also that there are clearly, as Wirral demonstrates, processes that could be put in place to capture more accurately the numbers of people who are being admitted with disease-related malnutrition. If they were screened and picked up more quickly, they could be given better care, and their recovery could be improved as a result. So those are some of the thoughts on the hospital admissions side. And if I quickly turn to the primary care side, as I set out earlier, there was a significant amount of activity within primary care relating to patients with malnutrition. Again, something like 10% of GP appointments are related to people with malnutrition. And we've estimated that something like 4.7 million additional appointments are taken up each month as a result of malnutrition. So a significant amount of patients are going through the primary care GP system with malnutrition. And then again, we did some calculations looking at what the rate of that was in proportion to the overall number of appointments that integrated care boards were seeing. And again, Black Country ICB found itself at the top with quite high levels of activity. 3 London systems, South East, North East and North Central, did as well, along with 2 systems from the North West. 9 ICBs recorded rates of below 14% of additional GP appointments being attributable to malnutrition, with Cambridgeshire and Peterborough at the lowest rate of 11.7%. So again, a distribution of appointments in primary care related to malnutrition is subject to quite strong regional variations, with the North West, as I said, and parts of London and Kent seeing quite high rates of GP appointments related to malnutrition. Other quick findings just to pick out before I come on to the recommendations and wrap up are social care. So as I stated earlier, there's something like 35% of people in care homes are estimated to have malnutrition. Now, when you look at the numbers of people in care homes across the country, that would equate to 160,634 people who are in care homes with malnutrition. And again, if you apply those data and those projections at an ICB level and try and make them proportionate, you see that there are quite strong variations. On the cancer side, we also wanted to pick a particular disease because we're looking at disease-related malnutrition. Obviously, malnutrition impacts people with a number of different diseases, whether it's cancer, COPD, stroke, and many others. But we picked cancer given that an estimated 40 to 80% of cancer patients have malnutrition. And we've estimated that equates to over 750,000 people with cancer in England with malnutrition at a cost. If you take that cost figure that I set out earlier, the updated costs of a patient with malnutrition over £10,000 is £6 billion. And as the population ages, the number of cancer cases will, of course, increase. And this issue of malnutrition and cancer will be a growing problem and challenge for the healthcare system. And as I said earlier, one of the things that we also sought to do in the report was to look forward to 2035 and sort of see what the future problem might look like. And we've estimated that there might be as many as over 500,000 more people with disease-related malnutrition as a result of changing demographics and changing disease in the population by 2035, and that we estimated that will cost an additional £4 billion. So there's some extra findings that are contained within the report itself. From a policy perspective, we did a quick search of some of the sort of existing policies and policy frameworks from government policy and from the NHS policy perspective at a national level. And what we found was that malnutrition has not been prioritised greatly within the sort of within core policy frameworks. There are references within certain documents. So the 3 green highlighted documents there do contain references to malnutrition and improved nutrition. So the NHS long-term plan, for example, talks about the need to improve nutrition in professional educational training. That was published back in January 2019. There are references to nutrition and malnutrition within secondary care, within the Commissioning for Quality and Innovation framework. That's to do with community-based community hospital screening, and within specific disease areas such as cancer and mental health, there are, as part of patient reviews, references to nutrition, but they are quite selective in how in their sort of scale and depth. But in many cases and many documents, many levers, incentives, monitoring processes, malnutrition and monitoring patients for malnutrition is not included at all. There is one reference within the government document to it, and it's a case study example included within the 2022 integration white paper, but no other references that we could find. So even though this is a growing and significant challenge, the policy frameworks at the moment don't necessarily prioritise it to the extent that we feel it is needed. And then finally, the report set out a series of recommendations. And what we feel quite strongly about is the policymaker push towards more prevention. So if you listen to either Steve Barclay, current Health Secretary, or Wes Streeting, both very much focused on how you can deliver a more prevention-focused healthcare system, we feel that malnutrition and malnutrition screening could play an important part in that sort of policy shift, screening people earlier, and then giving them the better care and support that they need. We'd also like to see greater ministerial recognition for tackling malnutrition. Malnutrition is not currently listed in any ministerial portfolios. If it were to be, then ministers would have to obviously engage with it, we feel, more closely and see more action being taken. We also felt that there were opportunities through the creation of the Major Condition Strategy, which is due out early next year. This is a strategy document from the Department of Health, which will set out how to improve care for 6 conditions primarily, but many of which have higher rates of disease-related malnutrition. So they will include conditions such as cancer, COPD, and others, stroke. And we feel that actually that strategy could be a good place to put down some markers and some action that the system, the NHS and social care services should be taking to improve action on malnutrition, particularly through screening. And we also included other recommendations at the ICB, Integrated Care Board Health System level, about getting better data out of the system, integrating care for patients, and making sure that opportunities to engage patients and carers, whether it be through new digital tools such as the NHS app and others, and a digital health check, could be used to engage patients to provide more information about their weight, their appetite, weight loss, etc., which could again enable a more preventative and front-end style conversation. So that brings me to the end of my presentation. Leslie, thank you very much once again for the opportunity to come and present some of those findings. There's quite a lot of information there. There's lots of analysis in the report, and I hope it's useful for everyone as we start Malnutrition Awareness Week.
Great. Thank you, Richard. I think that this has been very useful, and there's a lot in here. There's a lot of new worrying stats. And I think it was great that there was so much pick up in the media, because sometimes the media is very slow about picking up about malnutrition. So I felt that was a really good win that we had. I think one of the things that we need to be thinking about carefully is this 1 in 6 of carers who are looking after people who are at real risk. You know, this is in the community, and people don't have any access to nutritional support at all. They really don't know what to do. And I think that causes such a lot of stress to both the person being looked after and the carers. And then I thought it was interesting to see that the majority of the costs are on secondary care. So, you know, it's all there, isn't it? And, you know, again, worryingly, that more people are experiencing disease-related malnutrition.
Yeah, I think Leslie, on the secondary care piece, I think that's the costs there are so stark, and when people are going into hospital, if we could do better screening of people as they went in, I think then you would be able to get them hopefully more help and support as they were in, and reduce their lengths of stay and improve their recovery, and stop often the movement back and forth between hospital and the community, which is over time. I mean, hospitals are very expensive settings, so yeah, given where the NHS is currently at, I think trying to reduce those pressures is a good message to policymakers and government at the present time.
I think so. There's a question in the chat from Diane saying, really interesting population data. Do you have any insights about dehydration? And if so, how do you ascertain that?
So we didn't look at that issue specifically. I don't think we were able to break the data down in that particular way. There's no reason why, if we had estimates or proportions of patients who were suffering from dehydration, we couldn't apply those numbers to the numbers that we've set out. But there was nothing that we did specifically on that, unfortunately, Diane.
Okay, thank you for that. She says thank you. If there's no more questions, thank you very much, Richard. We very appreciate you giving your time to us today.
No, it's great, and it's a great time to be doing this. And all power to the group as continue to push for some positive change. So Leslie, thank you once again.
Thank you.